A very good afternoon to you everyone. It's a great honor to be here today, and I sincerely thank the organizers of HKES'S and Dental College for inviting me to share my insights on this today's topic. I'm delighted to interact with you all. Uh, I'm looking forward to engaging a thoughtful, provoking session with you all. So, to start with the impression making procedures in a implant dentistry, there's a certain armamentarium where which we ahead needed. That's impression trays, impression materials, a screwdriver, nothing but a hex drive, healing abutment, that's a cap, impression copings, and abutment per se. So when it comes for impression procedure, the armamentarium are simple as we use it for your FPD procedure. The same everything remains as FPD, a stock tray or a custom tray. And when it comes to impression procedure, here we do have a certain specific techniques where we broadly classify them as an open tray technique or a closed tray technique. As the name itself suggests, my dear friends, open tray means it is open so that it's entirely exposed. Impression copings are exposed to oral cavity, and a closed tray is something which is up where there is no opening onto that surface. It's a custom, and these are the custom trays. A custom tray which are flexure head a level, and these open tray or closed tray further we classify it in detail in later. So of course in open tray technique you do come across a certain modifications that what normally we are available in the market known as a Myra tray. This is a tray with a small file so that whenever you would like to proceed with the open tray impression techniques, you can just buy it from a market. When it comes to impression procedures, okay, this is what the steps. Of course, you do a second stage surgery. After second stage surgery, you place a healing abutment which will be kept in a mouth for 12 to 14 days so that it forms a very good healthy gingival collar onto the implant surface area. Once it is done, the healing abutment, a appropriate abutment is selected, a mold, a peri-implant tissue during a healing which prevents a tissue overgrowth. So once it is done, and on that we are going to place a scoping, and these scopings are nothing but impression copings. These are further, once again you do come across two types, one component which these copings which directly seats onto the implant. Once again, based on this coping, we'll see a further classification. This impression coping is a component that fits onto the implant fixture head, that is the implant per se, or an abutment surface which makes an impression. So this is what you do come across. These are, we call it as the impression copings. And these are the copings which we use it for the impression procedures, which can be a closed tray impression technique or a open tray impression technique. And of course, there are certain copings which you can modify it, and these modifications are nothing but a custom impression copings. Here we do come across impression copings. When you make impressions in implant dentistry, as I said, the copings are available, which we use it for a closed tray or open tray technique. At the same time, we can place a abutment onto the implant surface, as you can appreciate, and that is what even we can use it, and that further we broadly classify it later as an implant abutment level impression. Available in variety of a material, implant superstructure, something screwed or cemented, these abutments. So what the impression techniques are there? Okay, the impression techniques in coming to classification, impression techniques are broadly classified as at what level you make an impression, my dear. Do you make an impression at the level of an implant, or you place an abutment on it and you make an impression? When you make an impression at the level of an implant, then we call it as a fixture level impression. And when you make an impression placing abutment, and then we call it as an abutment level impression. We are going to discuss it later in detail. Further classification as pickup impression or versus a transfer impression, open tray technique versus a closed tray technique. And based upon the technique, there is a further classification, a direct technique or indirect technique. This is a broad classification of a conventional impression material in implant dentistry. So coming to the first technique, what is a closed tray technique? As I suggested, the name itself suggests a closed tray. It means that whichever tray you're using, you might be using a stock tray or a custom tray. There is no opening present onto the tray. So what is the procedure? Once after taking out the healing abutment, you take out the healing abutment and you place a impression coping over there of area of your interest. And this impression coping always, how you to make out, is it impression coping is a closed tray, open tray? Is that closed tray impression copings are always, they do have a short and they do have a key element so that you can transfer it. You place a impression coping, tighten the screw, dispense a material around the impression coping and make an impression as just like your FPD. And once you are done with it, you retrieve your impression. Then later you transfer the coping onto the area. So that's the reason the closed tray is also known as the transfer technique. Hope I clear you people. In a closed tray, what we do is we place an impression, coping and then make an impression. We unscrew the impression coping from a mouth and place it back in a tray and then pour a cast. This is what the closed tray impression coping. There's another what's available in market. This is a same closed tray impression technique. Coming to open tray impression technique. Open tray impression technique is, as I said, the difference is that in open tray impression technique is the whatever the tray you're using, a stock tray or a custom tray, it has got the opening for the impression coping. These impression copings are normally longer than compared to your closed tray and they closed tray impression techniques. So these are the what the impression copings, closed open tray impression copings. So this is a technique where the replacement of an anterior. So this is a custom tray where there is an opening and this opening is covered with a wax. You just make an impression. When you make impressions, you can make out these impression copings are protruding out of those uh, opening, whatever over there, and then you make it. In this case, you never personally transfer the coping what you have done earlier in the closed impression coping. So here in this case, you just unscrew the here your impression copings and impression copings will be the part of your impression per se. That's the reason this is your technique is a direct technique, pickup impression technique. So hope I cleared with you. Impression techniques are broadly two types, open tray or closed tray. Open tray is nothing but you where the tray has got the opening and the closed tray is something where the tray is closed. Open tray is a pickup impression where you pick the impression coping within the impression. Closed tray where you transfer it. Yeah, this is a main. Further techniques at the level of implant, how classifying two types of impression coping as transfer type, a pickup type. A transfer type remains on an implant where transfer you personally you transfer it to the impression coping, and pickup and transfer type is nothing but it's a closed tray impression coping. And pickup are automatically retained in impression after removal. These usually requires a manipulation of a long screw that are not present in the transfer coping. So, a open tray technique is nothing but it's a pickup coping. So the pickup copings are particularly useful where we use the pickup technique and transfer. Is that pickup copings are usually used in case of when there are multiple implants are there. In those cases, we pick up the entire impression copings which are splintered together with your acrylic, so that increases the precision of impression making. So further, there's other classification said is abutment level impression technique. Okay, the abutment, the earlier whatever I spoken you, that was a implant level impression coping because you have placed the impression coping, let it be a closed tray or open tray, but you place a implant, you place a impression copings onto the implant, and then you make an impression. So those are known as implant level impression copings. But here in this case, you're not placing any impression copings. You are placing a directly abutment on the implant. So that's, and you making an impression. So that's the reason these are known as abutment level impression copings. The simple to make you understand is abutment level impression copings are just like your FPD impression coping. To make you understand, I'm telling you what you do is this is the implant. Okay, what you do onto the implant surface, you place abutment and then make an impression, and that impression, whatever is at the level of the abutment. Okay, so that's the reason it is abutment level impression coping. Here other classification which you come across is direct technique and the indirect technique. A direct method involves screwing a final abutment into the implant in an oral cavity, followed by its preparation within the mouth itself using a rotary instrument. Preparable abutments are usually supplied in various materials such as it can be aluminum, zirconium, or a titanium. Once a desired shape is obtained, an impression using a rubber-based material is made exactly in the same manner as impression of prepared manual tooth is obtained. So whenever you place abutment, you do some alteration to abutment, take into consideration the for required for the crown, and then you make an impression. Then that impression is abutment level impression. But since you have done the alteration in the mouth, my dear friends, it is a direct technique. So it's a abutment level, a direct technique. So what is the advantage of this technique? It can be useful in varying situations. Utilizing a standard crown and bridge principle, an impression can be recorded of the prepared abutments directly in the mouth. And moreover, it is a cost effective and requires much lesser chair side time, my dear friends. So it has got a many disadvantages. One among them are shaping of abutment using a rotary instrument in the oral cavity creates a vibration on the underlying implant, which may affect the future prognosis. A lack of proper control on the instrument can cause a permanent damage to the abutment as well as a underlying tissues. So next is indirect technique. What is indirect technique? As the name itself suggests, direct, where you directly do the alterations of abutment in the patient mouth, and indirect, just opposite of it. Pick up impression copings technique at the abutment level. This technique is similar to your fracture level impression technique as it is utilized a machine impression coping which is seated on the abutment and where it is retained with a screw or the guide pin. This is exit by a hole impression tray. Following a setting of impression material, the guide pin is unscrewed, releasing the coping, which is designed with the retention anti-rotational features to secure it into the impression material. So then what do you do? Whatever the coping, you resetting a technique. With lack of a space, access the screw retained coping impossible. A non-retentive, usually tapered coping may be employed. This utilizes one-piece machine impression coping, which is screwed directly onto the abutment and remains in the mouth when the impression is removed. It is then unscrewed from the abutment and reseated in the impression. So this is what the broad comparison. What is the difference between an abutment level and implant level? One thing, ease of location requires whenever in the implant level impression, the subgingival placement of a coping, where abutment level easier because margins are often subgingival. Impression copings are very much necessary in implant level impressions. In abutmental compression impression coping without a coping is available in some cases. Abutment selection and the preparation when it comes here, impression implant level impression on the model in the laboratory. where abutment level you can do it in a chair side, onto the chair side. And modifications of any abutment not needed once delivered in implant level can be needed in the mouth. Custom available of abutment is there in implant level impression, but this is not available with the abutment level impression techniques. Interim and final crown fabrications can be performed in the laboratory together with abutment selection and the preparation when it comes for implant level impression, but here it has to be a chair side. So these are other few techniques which you can get it in articles. This is a modification technique where what they have done is they fabricated the a custom tray and they have kept the small hole for the opening of your impression coping. So there is an opening for impression coping. What is it, my dear friends? It is open tray. Okay, because you have kept the opening for your copings. And there's a small hole where we can inject the impression material, and from here inject the impression material. Once you inject it, once the impression sets, unscrew these copings and retrieve your impression with a proper technique. This is what the procedure it mentions. So inject impression coping through hole, everything it spreads over the area, wait for some time, once it's set, retrieve it back. So this is a technique which is a pickup technique. This is a technique which is open tray technique. So now which technique to use? We do have come across two techniques. Is it a direct technique, indirect technique, pickup technique, transfer technique, or open tray technique, closed tray technique? Review of abutment level or implant level internal connections implant indicated that more studies reported a greater accuracy with a splint technique with a non-splint technique. So what does it mean is that when you have many implants, there is a theory which proves that when you splint the implant with acrylic, that is more accurate compared to non-splint. At the same time, when you accuracy is much better with a open tray technique, which is nothing but pickup technique, than a closed tray technique, which we call it as a transfer technique. When it comes for impression material, polyether and VPS were more recommended material for the impression procedures. So these are whatever I spoke till now. It was a simple, a conventional technique which we had been using it for a long time, but now with the change of our procedures, hardly we come across going ahead with the same technique. Now, for everywhere we have come across a newer instruments. That is what the intraoral scanning. So these are intraoral scanning which transfer 3D impressions, a position of implant onto the laboratory, which is conventional technique when where is open tree or closed have a limitation such as distortion, multiple manual setups, digital impressions, improve your accuracy, efficacy, and patient comfort. So what is the difference between conventional versus digital impression? Conventional, where we use elastomeric impression materials, impression trays, and a longer time. Digital, use just a scanners, which is faster and more comfortable. It reduces the error accumulations and improves the reproducibility. Your digital impression has got some certain principle which utilizes a light, laser, or your conofocal images to capture 3D geometry, and the output is in the form of STL format or OBJ file format, and which then later there is a workflow for designing and manufacturing processes. This is a common workflow. We're not going to discuss in detail about the workflow. Here what normally is there is a here instead of the coping there is a something we do come across known as a your uh, scanning a data. Place a scan on that scanning with the help of a scan bodies, like just like impression copings, where we place the scan bodies onto the implant. Then we scan the entire of implant site and occlusal surface. We process and then just check the scan data, transfer digital file to the lab, and CAD design and CAM manufacturing will be done, and later lastly a train and final delivery. This is what the procedure, where once after placing implant you place, these are what was telling a scan bodies. Once the scan bodies you scan this and you get the impression, and these impressions we call it as a your digital impressions. Once the digital impressions, you can mill it and everything, you get the cast and you do all the planning onto the CAD, and your definite prosthesis is ready. This is a workflow of a digital scanning, digital implant. This is what the simple technique. A transfer implant position and angulation to digital model, usually made up of a PEEK or titanium. Correct the seating and a scan angles are crucial for accuracy. You check it out, and when you're placing so that is properly parallel to adjacent teeth and is seating well, check it out with a even IOPA. And this is multiple cases, the same you can use it. Multiple scan bodies placed, and then these are what the you get the image. So coming to accuracy, trueness, and precision, of course, precision repeatability across the scan, influencing factors, scan type, a technique operator, and an environment also. It has got certain advantages. It has got many advantages and a certain limitations. Main advantages: improved comfort and a speed, my dear. Reduced manual error, easy data storage and sharing. It has got a limitation, that's a high initial cost. Learning that curve, difficulty in scanning a deep and narrow size. Some tips are: maintain a dry field and retract the soft tissue. Start scanning from a stable reference points. That is very important, my dear friends. Verify the scan body fit. Rescan the missing areas immediately and calibrate your scanner periodically. To end with my presentation, what is the difference between conventional technique and a digital impression technique? Conventional, where you have to, there's a need of impression materials. Here, there is no need. Excuse me. So it's optical scanner, no need of any scanner. Patient comfort, it's a more comfortable is a digital impression material where you do come across a few times where gag reflex and discomfort of the patient in conventional impression. Conventional is a longer time pouring, you have to make impressions. If it's using a open tray, you have to make opening on a tray. It's a lot of cumbersome and tedious procedure. Here, my dear friends, digital impression is very fast and transfer. More manual steps are there in a conventional technique, where here hardly a manual steps and less of errors. Where conventional is dependent and handling distortions are there, where it's high precision with the digital impression. So keeping this aside, the future trends can be possible. AI-based scan cooperation can be operable, Siri or intraoral scan fusion, improved scan body designs, a full arch digital workflow are future trends. So the conclusion is digital impressions are transforming implant dentistry. For better accuracy, efficacy, and patient experience, proper training and workflow validations are essentials. And